Good day, everyone. Welcome. I am Cecilia Salazar. Welcome to Speak Your Mind. Your mental health depends on it. We are here today partnering with Lifeline Trinidad to start some very important discussions on this significant topic and day.
A significant day indeed, Cecilia. Good day, all. I'm Dean Bissoondial, and today is World Mental Health Day around the
Yeah.
world. October 10th is the International Day for Global Mental Health Education, Awareness, Advocacy, and Against Social Stigma.
Hi guys, I'm Vaughnette Bigford. And we've been talking about it, but this COVID-19 pandemic has had a major impact on people's mental health. Some groups, including our health workers or frontline workers or creatives or students or people living alone and those with pre-existing mental health conditions have had it especially hard, and they've been particularly affected.
And today on OMG Live, we are starting this very special series. Speak Your Mind. Your
Your mind.
mental health depends on it. Because at the heart of good mental health is really speaking about it. Yeah?
Yes, and there's a lot of misconceptions and stigmas surrounding mental health. Even if we feel there's a problem, many hesitate to get treatment because they don't want anyone to know that they're having issues.
Yeah, Dean, and that's why we've partnered with Lifeline, and Lifeline is the suicide helpline because people dealing with mental health issues can have several different things happen to them. We've had people who have turned to suicide and murder and other things that are not particularly
Chronic
positive.
depression, yes,
Yeah.
yes.
Yeah, so today we have an excellent panel lined up to provide us with some perspective on this topic. We want to know what is mental health really and how it affects our daily lives and what resources are available out there to help us.
Yes. So on our panel today, we have Dr. Hazel Othello, Director of Mental Health at the Ministry of Health,
Thank you.
Professor Gerard Hutchinson, Head of Psychiatry at the University of the West Indies, and our friend here at OMG, Lucy Gabriel, Chairperson of Lifeline. Welcome, everyone.
Such a fabulous, heavy-hitting panel this afternoon. So
Yes, boy.
before we start our discussion, let's look at this short video that explains what is mental health.
We all have mental health. It is just as important as physical health. It is not only about mental illness or mental disorders. This is just one part of a bigger picture. It's best to think about mental health as being on a continuum, rather than people being either mentally ill or mentally well. We are all on the continuum, and we move up and down according to factors such as our genetic makeup and upbringing, our life circumstances, and the stresses we are under. At one end of the continuum, we have mental disorders, like depression or anxiety. And at the other end, we have states of positive mental health, when we're thriving, content, and fulfilled. The aim of mental health interventions is to move people up the continuum, so that they're able to reach their full potential and live satisfying lives.
Fantastic. Thank you so much. And welcome, Dr. Othello. Welcome. Can you tell us first about your role at the Ministry of Health and what is our national position now with mental health and mental health issues, especially 20 months into a pandemic?
Good afternoon, everyone. My role is that of the Director of Mental Health, the Director in charge at the Mental Health Unit in the Ministry of Health. So that unit is a policy unit. We determine and help the regional health authorities with implementation of policies aimed at improving mental health services for citizens, but not just citizens, anybody within the borders of Trinidad and Tobago. So the RHs implement the mental health services and we assist them in determining policies, fine-tuning those policies, and providing guidance, technical guidance for those implementation activities. At this time, where we are with respect to mental health in Trinidad is very interesting because for many, many years, most of our mental health services were hospital-based. We've had clinics in the community, but the vast majority of mental health care has been provided in hospital settings. And we're at a time now where we're working to reverse that trend, so that we want, as we go forward, more services to be provided in communities and hospital care to be really a last resort, so that persons go to hospital for the shortest possible time and return to their communities. And we look forward to a day when we will not have people living in psychiatric hospitals for years on end. So that, broadly speaking, is where we're at.
Professor Hutchinson, in your opinion, what are some of the critical mental health issues we face as a country?
Hi, good afternoon. Well, I mean, I think the pandemic has in some ways altered the mental health landscape because of all the stressors associated with it. But I think in terms of the conditions themselves, certainly depression and anxiety are quite significant. Self-harm and suicide, I think, continue to be challenging problems. I think substance use related disorders, alcohol, other substances, which is a constantly evolving problem. And those problems are not just related to the use of these substances, but how they impact on things like depression and psychosis and other kinds of mood disorders. I think also there are also, if you will, secondary issues. I think a lot of the crime and violence is related to mental health. A lot of the issues that we see in the schools are related to mental health. So I think those would be the things at the top of the list.
I have a follow-up question that I want to throw out there. On the radio a couple of nights ago, I was listening and I heard that, especially now during this pandemic, women in particular are, I guess, predisposed to burnout and fatigue and stressors. Are there any research papers locally that support this notion?
I think that's an interesting point. I mean, women generally, and this is pre-pandemic, reported, and research across most countries in the world shows that women tend to be treated more for things like depression and anxiety compared to men. But it's not clear whether that's just due to their commitment to seeking help compared to men. And of course, in the pandemic, they've had to juggle roles as mothers, as wives, caretakers, caregivers, as well as work if they are employed, have been employed, and all the issues with parenting and online school. So I think it's that multiplicity of roles that would have contributed to that sense of burnout and fatigue. But on the flip side of that, women live longer than men across the world again. On average, the life expectancy of women is about 7 to 8 years greater than men. So it's not all negative.
Thank God.
For Lucy, so Lucy's of Lifeline, and Lifeline is our suicide helpline. And I said hotline, and she corrected me earlier that it's a helpline, and I like that word. So people kind of meet you, or people tend to call you when maybe they think they've tried everything and they're reaching out to, this is the last option. At least that's how I think of it. But some of these people who are calling you, and what are some of the critical problems that they are facing or that they call in with? If you could share some of that with us, some of those with us.
Basically, it is that they have problems with what you would consider the ordinary spectrum of life. They are not. They wouldn't consider themselves mentally ill. They're not. It is problems with their closest relations, their family, husband and wife, boy, girl, children going to school, struggling with trying to traverse being a teenager into adolescence, going through university, etc. But for it to become suicidal, it is that those normal, if somebody has a problem, they could live with it and die at 80. But it is when they have let's say they have a problem, and that problem really relates to what they think of themselves. Let me give you an extreme example. A woman faced with having a hysterectomy and having had it, there are some women who would become suicidal at that because their sense of themselves, even though they may use contraception, is really based in their ability to have children. And if they can't have children, then they are nothing and nobody. But that is not a mental illness.
Right.
And it is when that view of having that health challenge constricts to the real solution to it is to kill myself, then the person becomes suicidal. And at that point, if we're lucky, they could call and talk about it, talk about things that they've carried in them, and they don't talk to anybody about. And that they would feel safe enough because we guarantee that the fact that somebody's called us and what they said to us remains confidential. Nobody will know about it. We're not allowed to report on it in any way. And then that space between, and that is part of their mental health. When somebody gets into crisis, and they feel it is when that crisis becomes the only solution to my problem is to kill myself. And that is why you may not know, because they may have been down, but they suddenly become settled and happy. And people say, but how come? You say, well, what do you feel like? If you have a major problem and you solve it, you feel release, it's okay. And then 2 days later, the person's died. If we're lucky, they will call and you can talk to them. But the person is not necessarily suffering from a mental disorder. That is the difference. But it is along that spectrum.
Excellent. We just had a question here from
Mitch.
Yeah, from Mitch Singh, and he's asking what is being done to protect employees from employers that are abusing staff by overworking them, which contributes to their mental illness. Dr. Othello, is that something you could address?
While it's an excellent question, as a mental health professional, I am not in the realm of being able to tell an employer what to do.
Exactly.
So that is a bit of a challenge. But what we can do is work with the employee in terms of building resilience, coping skills, communication skills, so that they feel more empowered to talk about what's happening in the workplace. Sometimes people aren't aware fully of the channel of communication within their organization, who to go to, who to discuss these types of problems with, what the whistleblower provisions may or may not exist within the organization if something like that is happening. So that, and these things vary from organization to organization. So it's very difficult to find one single answer in terms of working with the employer. But as a mental health professional, I think we do more work with the person who is feeling stressed, the person who is feeling overwhelmed, and we help that person to cope.
And if I may add to that as well, Dr. Othello, is as a first line of defense, most of the times organizations have an EAP system.
Yes, absolutely.
They can refer themselves to.
Oh, that's excellent. Another question I have, maybe Lucy, all the violence against women and murders and murder-suicides that seem very prevalent around the world and especially in Trinidad. Are they linked to mental illness? What is the difference? What is the difference? Is being suicidal a mental illness?
Well, I think that's more a question you may ask Professor Hutchinson.
All right,
In
Professor
my-
Hutchinson.
It's not a mental illness, but that is not my specialty to define what it is.
All right.
Yeah.
Professor Hutchinson.
Well, I think it's the idea of what is a mental illness. I think the video that was shown earlier pointed to that idea of a continuum between mental health and having a positive state of well-being on one end and having a mental illness on the other. So I think being suicidal specifically is not in and of itself a mental illness, but it is a sign that a mental illness could be forthcoming. And that the idea of that continuum really is to serve as a kind of distress signal, so that the presence of certain symptoms, certain feelings, or the existence of certain behaviors should tell the person or the people around them that they are moving down the continuum, moving down the steps, to use the analogy of the video, to perhaps developing a mental illness. And I think in some ways, going back to the question that the person asked about employees and employers, the thing really is to try to intervene as early as possible to prevent it getting to be a mental illness.
Thank you. Thank you.
If I
Dean?
could add,
Yeah. Yes, Lucy?
if I could add that when you look at the men who then kill somebody, murder wife, children, and then themselves, if you look at it in terms of his sense of himself, his control, that he feels threatened, very threatened, and you either do what I tell you to do, or I will kill you, and I will kill you, and I will then kill myself, so nobody can touch me. There is that side to suicide, that it's an act of final control over somebody else. And if you look at the range of people who do this, look for it and you will see it. But he has got into crisis, and it's his sense of himself. It's not that I think you could see he's mentally ill, but there is that in it.
Yeah, two very good points. The sense of yourself and early intervention. Two very good points there. Dean?
Yes. I think now we have a picture of what are some of the mental health issues we're dealing with as a country. But what are we doing to deal with it? Let's jump into our next segment called Dealing with It.
Right, so Dr. Othello, we're back to you. What are some of the areas available for people to deal with their mental health issues right now in Trinidad?
Okay, one of the things we always emphasize is that not everybody who needs some kind of help with their mental illness needs the highest level of professional help. Help can come in many forms, and sometimes people just need to talk to a friend, talk to a pastor or a leader, talk to somebody who you can confide in, who gives you good advice, who you trust, who you can listen to, and who can assist you in coping with whatever the difficulty is. But we do acknowledge that very often it goes beyond that, and people need higher levels of care. So that within the regional health authorities, there are mental health services. Psychiatry is unique among medical specialties. It's the only one where we go to you. We don't wait for you to come to us.
Right.
So that for many, many years, we've had specialist clinics in the communities, in Princestown, in Point Fortin, in Scarborough, in all over Trinidad and Tobago. There are many, many clinics where people can access mental health care and those services. Within those services, you find psychiatrists, psychologists, mental health trained nurses, social workers, wide range. And now we have some specialties that we didn't have before. We have what we call creative arts therapists, the art therapists and music therapists and things like that. So we have a wide range of services available at that level within the government healthcare system, and then within the private sector and the NGOs network and so on. We have a number of free services as well. And those can be located through a locally produced website, findcareTT.com, and that website takes you to a number of resources. And Lucy's NGO is one of those resources.
Professor Hutchinson, anything else you would add to that in terms of what people can do to deal with the issues that they have? But before we go to that, I have this, and I've always had this. It's just like this thing that goes on in my head. Now, I tell people that I go through periods of lows. I'm very hesitant to call it depression because I've never been diagnosed by anyone as someone who's depressed. But I know that there's something that happens with me. And sometimes it can be for an extended period, weeks on end, where I have these period of extreme lows. And I don't want to label it, but I don't know if you can maybe talk about it, about the difference between someone being depressed and someone just having depressive episodes, or just having, you have a bad mood, but you're in a bad mood for 2 weeks. But there must be some sort of difference, or I don't know. But I honestly know that I go through something, and I'm very hesitant to say it's depression because I've never been diagnosed. So that's for Professor Hutch.
Well, I mean, I think that going back to the question about women earlier, one of the other things that predisposes women to having more depression and anxiety is the hormonal changes that they go throughout the life cycle.
Yeah.
So it is, for some women, there's a kind of periodic shift, and there are times when, because of the hormonal changes, they do have periods when they're more anxious, more irritable, feel a little low compared to other times. But in response to your question, comment, I think that the existence of those shifts is not necessarily a sign of having depression, or as we call it, major depressive disorder. But it is persistent, and particularly if it affects the way you function. So if it interferes significantly with any of the various roles that you play, then it probably will at some point require some kind of intervention. So the criteria to diagnose a disorder is a combination of the length of time you've been experiencing the symptoms, the particular combination of symptoms you've been experiencing, the severity of those symptoms, and the degree to which they interfere with your ability, like I said, to do what you normally do. So when you put all of those together, the threshold becomes a little clearer. But I think there are lots of people who do have depressive episodes and never seek help. And because for the most part, it's something that will probably not survive forever. So you'll have periods, like you said, when you are like that, and because you get over it, you feel, well, okay, it's not something that requires intervention. But if you find that those periods are getting longer, or they're happening more often, or when they happen you're feeling worse, then it would suggest that it requires some kind of intervention.
Good. So you are really talking about a level of self-awareness and self-examination as well that we have to do on ourselves to be aware of these mood changes. And a question we just had there was, how does a layman recognize these symptoms in other people, in their friends, and know when maybe to intervene?
Well, again, I think the thing is to note and observe the person's behavior, and if there's a shift where the change in behavior is associated with distress or associated with a profound change in functioning, so they've stopped going to work, or they've stopped talking to their friends, or they've stopped being the person that you knew them to be, I think that is a sign that some kind of inquiry should be made. I think that point you made about self-awareness and self-examination is probably the ultimate self-care tool. And unfortunately, it's not something that many people do naturally. And I often tell the people that I see that it's one of the benefits of having a condition that, in a sense, forces you to do that, because I think it's the way to help you recognize when things are going wrong, and also identify the reasons it might be going wrong, and of course also provide the motivation to do something about it.
Being mentally healthy means being resilient and able to cope with difficult times, feeling in control, being confident, feeling good about yourself, managing and expressing your emotions, building and maintaining good relationships.
Wow, all of that involved in being mentally healthy. Ooh, a lot of work. Dean, you have a question?
So yes, where can we find help? What are the everyday things we can do to cope with your issues? Let's discuss and see where we can find some hope.
Okay, well, I want to know first about Lifeline. I want to know where Lifeline stands on, yeah, it's pulling it back to Lucy. Where Lifeline stands on this whole issue of helping your friend, or how to seek and recognize all the symptoms.
We stand very much on the basis that you do talk to your friend. You don't run away from it. Don't be afraid that something's wrong. You notice something wrong with somebody, that you can very gently ask them, how are you? You're not alone. Ask the question. Don't be afraid to do that. And also, we create an atmosphere in which people cannot see, because so you could go and visit somebody in hospital who's just had a major operation, and they've been in tremendous pain whole day, and you say to them, how are you feeling? And they say, fine.
That's not a response.
And they're not fine. They're not. It's paying attention, and it's knowing that, okay, that if you're my friend, and that is really what you do, that you are emotionally honest with your friend, that you keep, that they know you will keep their confidence, and that if they do need help, they do need, for example, to go to a health clinic. Not only would you find the number, but you may take time off and go with them. To the clinic. And if they won't go, you will go, you'll find the information. You can call, but it's the general, a lot of it comes from the general atmosphere we project for other people. That really and truly, for somebody to tell you about their problems, they must take down their public face and let you see what is behind it. We're all very good with our public faces. And so making it that, really and truly, you don't just say, well, that person's crazy. No. You ask the question. You look a bit down to these. And also, it's simple things like don't minimize somebody's pain. Or, I had that, this happened. No. How do you feel? Does that make you feel angry? Does that upset you? Does the fact that somebody really doesn't listen to you disrespect you? Do you feel disrespected? And you would listen to the stories they have to tell you. And Lifeline does have a 24-hour service. The unfortunate part about it is we do not at present have enough listeners that you would call and you can immediately get through, because our calls can last, our longest call has lasted 7 hours.
Wow.
Oh, geez.
Once somebody calls us, you can't say, well, I've talked to you enough now, bye. You can't do that. You have to go along. But it's the ordinary, everyday things that you would notice about the person. Because when somebody does kill themselves, other people say, well, she was all right. They're not.
Yep.
And the people closest to you, because you just don't listen to them. Like the woman who says, nobody listens to me anymore. They make decisions around me. I'm not important. It's
Right.
my house, but they make the decisions.
Right.
Those things. They are
So Lucy, what
like
I'm
coats
getting
with razor blades on them, and as people pass you, they cut you with it.
right. Lucy, what I'm getting that you're saying is active listening is an essential skill for someone, in that position to help someone through a crisis.
Yes, it is.
Yes.
There's passive listening and there's active listening. If you
Right.
listen actively, you listen to what the person has to say, and then you replay it back to them in their
Yes.
terms. And it's
Yes.
also not being judgmental. It is that person's perspective. And it's probably most difficult in a family, because the person may be complaining and they're complaining about you. You're the problem.
Mm-hmm.
And for you to say, okay, for you to realize that is the way they see you. So instead of being defensive, saying, okay, you're very angry at me, aren't you?
Yes.
And you see all the guilt, the anger, you're afraid, you're shamed, naming the feeling, then you don't feel well. It helps to bring it down. That feeling of being suicidal rises and falls.
Ah.
And really, too, people become more suicidal again when the view constricts, but they feel separated from other people. That is why it doesn't matter if I kill myself. Nobody will miss me. If it's my children will get over it. They won't. You see? But they become separate. Person becomes separated in their mind from those around them. That emotional connection is severed. On an everyday basis, if you can re-establish it and establish it long enough to persuade the person that yes, if you do go to the clinic, yes, if you may have to wait for a long time, Professor Hutchinson in Mount Hope, but you will get there.
Yes.
It will make a difference. You should take his medication. It may not work immediately, but it will work.
We have a couple questions.
Yeah, Vaughnette. Yes.
Yeah, we have a couple questions. I want to get, maybe even Lucy might have to answer these questions. A couple of questions that, right. So Eulalie is asking, what qualifications, if any, does one need to volunteer for Lifeline?
Well, I think the major qualification is you don't have a good sense of self-protection, because you just send, like, whatever you can do to help. Lifeline is more than happy to have what you can do, with whatever you can do. There are those who listen, and there are those who support the service to listen.
So how does one get involved in becoming a volunteer? Well, what's the process?
Send Moya an email at ttlifeline@gmail.com, and you start the process. It's a self-selecting process. She will reply. She will tell you, send you information on it. We have information on it. People are surprised at how much that we have quite a clear system
So
of
actually,
identifying.
one of the questions is there any sort of formal training involved from one of our?
There is. We are very careful about words, so we would say it's preparation because you choose to be a listener. The listeners are selected, and therefore it's a skill. It's something that you have, and it takes up to 3 months to become a frontline listener. We're very careful about that. But again, if you're a friend too, and again, we need a lot of people because listeners remain anonymous. It is the people you would see representing Lifeline publicly are friends of Lifeline. They know all about its work, etc., but they're not listeners. So people who like action, like to do things, would like to set up a website, go to public events and represent the organization. They do that kind of thing. They're on the media committee. They'll go to communities and work to do the schools outreach, the YTC outreach. They take the action. The people who man the phones, they are listeners. They're more passive, but they will sit and they will listen. All of that is work that needs to be done.
I saw a question before, Sal. I want to ask Dr. Hutch. This question is from Francis, and she asked about the process for diagnosis. She's saying, I have a psychologist friend who thinks I should be screened for bipolar disorder and schizophrenia. What is the process for getting screened? Or maybe Dr. Othello. I could answer that one. I don't know. Who's more? Anybody could jump in there.
Anybody.
You could go ahead.
Okay, I'll go ahead. You asked to, I would bow to Prof any day, but basically you need to be seen by, if the person who's making this suggestion to you is a psychologist, that person already has a certain amount of mental health exposure and experience. So they would have, some good reason for thinking that you need this screening to take place. And the people who generally do that type of evaluation are medical doctors who are specifically trained to do it. So depending on where you are, if you have direct access to a psychiatrist, then by all means, make an appointment and see that person. But if you don't, you can start with your general health center and they can refer you to the appropriate person within the healthcare system and within the community where you live who can do that evaluation.
Okay.
Thank you very much. Now, the main issue is where can we find the help, and let us look at that now. Right. Well, Professor, where can we, what are everyday things we can do to cope? If everyday things that as the individual we can do to cope to help ourselves?
Well, I think the fundamental thing is to take care of yourself. Sleep is especially important.
Really sleep, writing it down.
There's a talk by a guy called Matthew Walker where he says sleep is our superpower.
Jesus.
So, and in the age of social media and continual distraction, insomnia, people not sleeping is like an epidemic. So getting good sleep and enough sleep is critical. Of course, your diet, eating enough fresh food, eating enough green food, eating enough fruits and vegetables, exercise. So those fundamental things apply to health, whether it's physical or mental. And then the next level is relationships.
Right.
I think you have to ensure that you have good relationships, positive relationships, as Lucy was saying, relationships where you can talk to people when you don't feel that things are going the way you'd like them to go, and where they would listen, because not everybody wants to listen either. So I think nurturing relationships is critical, and paying attention to them, not taking them for granted, and that's both, you know, close relationships as well as relationships, you know, beyond your close friends and family. And then I think the other thing is to have a sense of purpose or a sense of meaning. I think it's important that you kind of seek that out in your life. And of course, that purpose could be just taking care of your family. It doesn't have to be anything grand or world changing. But I think it's important that when you get up every day, you feel that there's a reason that you're prepared to go out there and deal with the demands that life places on you. And the other thing we talked about earlier, self-reflection, self-awareness, self-examination, really seek to understand yourself, seek to know yourself, be honest with yourself, try to do things to help you improve that relationship with yourself. And I think in doing that, you'll be able to nurture a greater sense of connection with the world, offering gratitude, offering having some connection with whatever higher power you respond to, and you know, doing things like meditation and yoga and things like that, which also help with self-awareness, and you know.
I saw
Thank
someone
you
mention,
so much.
I saw someone mention earlier the need to have a support system as well. I think that that is also very crucial.
But I think that's where the relationships come in, and that's why I said you have to nurture relationships in a way that allows those relationships to support you.
Right.
And also it's a two-way thing, where you can provide support for the people in that network, because even giving support helps your mental health as well.
Yes.
Yes. So
You know,
good.
so I was thinking the other day that we live in a society where we see somebody and we ask them, "Hey, how you going?" But we really don't want the answer, you know. We need to be honest. I'm actually guilty of it myself. You meet somebody and that's just your, "Hey, what's up? How you doing?" And before that person answer, you don't head in towards your car. It's just like, but it's a reminder that really and truly we really have to provide a space. And when we ask someone how they're doing, we really have to be patient and ready to hear the answer, because a lot of people don't respond because they know we don't particularly want them to go into how they're really doing.
Yes, exactly.
The natural response would be, "I'm fine." That's what we want to hear. That's what
well, not me. I give people an earful. I'm the one that's run from. Well, you know, this morning I got not feeling well, but I'll give you a whole earful. But it's something that doctor said there when he's talking about as a nation, can we foster this mental health among us citizens, just like we do things like saying eat your vegetables, and we tell people to exercise. Could we be doing some sort of campaign where we are encouraging people to develop their mental health, to keep their mental health healthy? Dr. Othello?
Yeah, I think that's critical, and to a certain extent, we try to do that from time to time from the mental health unit. In fact, for World Mental Health Week this week, we're doing quite a bit of media publications, you know, in the newspapers and so on. And for World Suicide Awareness Day, we did some of that as well. And we, you know, sometimes we're not able to do as much of that as we would like to. But it's very, very important, and it's important for us to not just do it in that kind of seasonal way. It's important for it to start at the very lowest levels, and even in primary school, we need to talk more with children about their mental health, so that they understand from an early age that, you know, your physical health and your mental health are equally important, and they begin to understand the things that they can do even as children, you know, and who to talk to if you're not feeling so well. and things like that. So the conversation definitely, has to be had in a much more holistic way than we're doing it right now.
Yeah.
Thank you.
There's some myths too. I wanted to talk about this, and maybe Hutch can help me out here. So I like. I had an experience of having a friend who suffered from depression or had been dealing with depression, who eventually died by suicide last year. And I remember in a conversation we were having the other day on OMG, when one of us, Penny, was expressing that, she thought when she thought about someone dying via suicide, she thought she couldn't understand and she couldn't relate, and she thought it was something that was selfish. And I remember distinctly holding on to that point because this friend of mine who died, I had a conversation with her maybe 3 weeks prior to her death. And in that conversation, all she kept talking about was making it better, her absence, making it better for her loved ones, in that making it easier for them. And, feeling like a burden and feeling like it's a burden on them to have to deal with the fact that she couldn't control how she was feeling. So that was her take. In her mind or in her head, it was something. So it was totally an unselfish thought. She was thinking of it as easing the burden of those around her. But those of us who can't relate to it, saying, because I've thought of it as something like that before. I mean, how could you be in that headspace where you could think of doing something like that? I don't know if you could talk about that a bit, Doc, in terms of. Yeah, I just wanted to
clear it up for you.
Yeah.
But I mean, I think that there are many roads. I mean, there are many roads that lead to that final act. And I mean, like you say, a lot of people think of it as a kind of selfish act because you're not thinking about how your behavior is going to impact on your loved ones and the people who care for you. But in many instances, people feel, as your friend expressed, that in fact what they're doing is for the benefit of their loved ones and their and people who care for them, because they see themselves as a burden. They see the suffering that they are experiencing as a burden on the people around them, and they want to spare them that burden.
Yeah.
And again, that goes back to that exchange you all had about asking somebody how they're doing, because caring for somebody who has serious mental health issues is challenging. It's not easy. Lucy was talking about a call lasting 7 hours, having the patience to really engage that person. It's not something that necessarily comes easily to everyone.
Yeah.
And sometimes they lash out because, again, relatives of clients of ours who have serious mental health problems have said that they get tired, they get fed up, and it's a very complex and dynamic kind of relating that occurs. So there are all kinds of reasons that people decide that they want to end their lives, and sometimes those reasons are related. They really genuinely think they're going to make the world a better place by not being in it.
Yeah.
So and that's why it calls for, as Lucy was saying, a kind of non-judgmental listening and a kind of empathy to really try to see the world the way they're seeing it, and to work with them as best as you can, and of course encourage them to seek help in order to manage those feelings.
Thank
Could
you.
I say something?
Sure.
Definitely.
The way that I look at that, when somebody says, I am a burden to the others around, is that really and truly that it is, consider that to the people who love you, you're unique. There's a space in their life that belongs only to you. Nobody can replace that.
Yeah.
So if you're healthy, great. If you're mentally healthy, even better. But you see you being gone, now,
Yeah.
they're not going to get over that. And
Yeah.
perhaps the greatest hurt, but it is not something you express to somebody who tells you, I have decided to kill myself. It is that for those, and this is where we have to start talking about those who survive somebody killing themselves, that it is the central thing that whether they may quarrel with you, all kinds of things, but in their life, there is a space that belongs only to you. Drunk, sober, mentally healthy, and guess what? On the day they come to that is a pain that is unimaginable. But still, we appreciate the fact that this person who's about to kill themselves, thinking of killing themselves, to them, the worst pain is what they're feeling, and they want to end the pain.
Yeah.
Well, thank you so much for that. I would like to go into our next segment now. Where can we find hope?
Where?
Well, Dr. Othello has told us of that we can go to health centers. It's as easy as that, right, Doctor?
Yes, it is. It's as easy as that.
We think it's so difficult.
It's easy from the point of view of the services being easily available, but it's difficult from the point of view of the person making that decision to take that step. And
Right.
that can be very difficult sometimes. And that is where those relationships that Professor Hutchinson spoke about become very, very important. Because sometimes somebody needs a friend or a colleague or somebody who is interested in their well-being to, so to speak, hold their hand through that process, walk them through that process, go with them to a clinic, wait in the waiting room until they're done, ask them after they've had their visit, are you okay? Is there anything I can assist you with? Do you need me to go with you to fill a prescription? Little things.
Yeah.
But sometimes some people need someone very often to walk them through that process.
Yeah.
Not only that, sometimes with mental health disorders, the person knows that they're suffering, but they don't quite know what it is. And sometimes people don't know that an illness called depression exists. They don't, and if they know that it exists, they don't know to the extent that it might be treatable. So, it's important that someone assists them in that regard so that they get the help that they need. Sometimes, you're withdrawing into yourself, you're staying in your room alone, you're not talking to anybody, but you don't think something is wrong with you. You think something is wrong with the world around you. That is suddenly being mean to me. Nobody cares. Nobody thinks about my feelings. And, that's how the person feels at that time. And I always tell people we can't, legislate feelings. People feel how they feel, and that's it. And that's why Professor Hutchinson spoke about not being judgmental. So it's important for the people around you who see what's happening to, in a non-judgmental way, talk to you and let you know that I'm seeing something changing and I care about you too much to allow you to just continue down that path. And I want to help you to get the help that you need. And that's very, very important.
There was a question there. I want us to at least give that gentleman some points if we could. I think he said that he's finding it difficult to stay motivated on a daily basis. Just to complete simple tasks seem burdensome, and he's asking for any tips on staying motivated. Anybody could jump in there.
Well, I think the first step is to understand or attempt to understand why he is feeling the way he's feeling. And is it that he's distracted? Is it that he's going through something in his life now that is diminishing his ability to stay motivated? Is he in some life stage that is bothering him? Is it the pandemic? I mean, all kinds of potential reasons. But I think the first step is to try to identify what it is and why it is. And if in doing that self-examination you can, then maybe the next step would be to talk to somebody. And maybe, because many times the other good thing about relationships is many times the people around you see things that you don't see in yourself, or you haven't taken note of. But because they know you and they're looking at you, they could tell that things have changed or are changing. So I think that'd be the next step. And to perhaps get somebody to help him, work with him to stay motivated or to get motivated, give him a call in the morning or, help him with some tasks. And then the next stage beyond that would be to seek some kind of help.
Gosh, well, thank you so much. We're talking about hope, and just the fact that we have the three of you here signifies to me that there is hope. That we have the ministry, we have the professor, and we have Lifeline willing and there for us.
Real heavy hitting panel there. Real heavy hitting panel. Oh my gosh.
And people don't give up hope. Don't give up hope.
Not at all.
Dean, would you like to say anything there? Question?
It's a first step to bringing this discussion to the fore, which is, it's been taboo. We've discussed that at the opening. It's been taboo for too long. And an honest discussion is what is needed.
Great. So I want to thank everyone. Thank you, everyone. Professor Hutchinson, Dr. Othello, Lucy, for being with us today and starting off this important discussion. Speak your mind. Your mental health depends on it. We started today because today is World Mental Health Day. Right, so take care of your mental health, everyone. And before we go, we have this great video done in the UK. And I want to thank everyone for being with us today. And join us next time.
Join us next week.
Yes.
Thank you guys. Thank you guys, Dr. Othello. If I didn't tell you before, you are absolutely fabulous. You're absolutely fabulous. Thank you for all the work that you're doing. Thank you so much. Thanks to Hutch and thanks to Lucy.
Thank you so much, all of you, for all the work you're doing. Keeping the hope alive. Thank you.
Thank you.
You're most welcome.
Have you ever lost rhythm or reason? Struggled for motivation like time stopped in a darker season? Ever felt trapped in a cycle of negativity? Overwhelmed by anxiety or uncomfortable in your own company? Like your skin doesn't fit? Or like you couldn't give even the tiniest bit of yourself to the people you love? There's a good chance you might have, and if not, you might. There are millions fighting this fight. And there are times in this fight when we might need heroes. Someone to talk to and someone to hear us. Someone who's there for us when we are ready. Who won't shut us down if the conversation gets awkward or heavy. Who'll ask if we're feeling okay. But who are they? If you can be there in the difficult moments, if your ear can be a refuge when our words are homeless, if you can be patient when we need to complain, hold on to your judgment and let us explain, then together the power is ours. We have the opportunity. We can be the generation that makes a difference. With our determination, we can build a time of acceptance. We can understand how our mental well-being affects us. We can reach out and listen to those around us. Together, we can. We will.